Thanks, Nancy and Jim, for inviting me to here and for organizing this one. So, having heard this wonderful talk from people with lived experience, from local governments, from clinical epidemiology and medicine, and from other colleagues, it's clear that we having the same voices. It's the policymakers, the world leaders who need to listen to us and act. So my talk have a focus on policy landscape. I will start with sharing some facts, and I share with our asks for policymakers around the world. And I will talk about system thinking approaches, which I think people will talk about today, and give you expression, how can we understand system thinking? Then I will share some opportunity invitations for people to contribute. So very quickly, obesity affects over 1 million people globally. It contributes to almost 4 million deaths every year, driving over 40% of diabetes cases and up to 78% of hypertension and over 13 different types of cancers. It costs the world by 2030 3% of our global GDP. It's a universal crisis, but it remained politically ignored. It's widely misunderstood as a personal failure rather than a structural injustice. We need urgent collective actions from policymakers, healthcare providers, media, and the public to make real changes. We must rephrase obesity as a complex systemic health challenges in all ways and areas. So I co-lead the working group for the World Obesity Federation to support the writing of the political declaration of United Nations High-level meeting on NCDs. My colleague right now working really busy in US at the moment. We are still doing our best to try to change the language we have seen in those drafts. Suddenly, we have seen continued weakness in language for obesity, and obesity is not currently recognized as a disease. So this is not for you. This is for policy leaders, for leaders of countries and member states. We urge member states, including the UK governments, to work towards making meaningful changes. We ask for 3 things. Acknowledging obesity as a chronic complex disease that is the major driver of many other major NCDs. Since 2018, obesity has been recognized formally as an NCD, but is currently missing from the political declaration. Committing to implementing WHO obesity-related recommendations, including measures to ensure a healthy food environment, and particularly reducing the availability of ultra-processed foods. Committing to integrating obesity prevention into primary care, which is largely missing in most countries. I think in the UK it's doing better than many other countries, but we still have a lot to do. And I read our position papers and published in BNJs explaining why it's important, why global leaders need to join together to take real action for real changes. We have increasingly heard the term system action, whole system approach, systemic action. What do we really mean that? And what does it look like in practice? I can spend days here to just explain what it means. But I think one simple way to illustrate what it means is to draw a diagram. So this year on the World Obesity Day, the 8th of March, myself and Boyle introduced the obesity system iceberg. This diagram visualizes 4 levels of intervention through system thinking. There are 3 key messages here. First, most of the system is actually below the surface, out of sight. The deeper the determinant, the harder they are to see and intervene on. The effect and sustainability of systemic and synergistic intervention is greater than that of surface intervention, such as education. So I was asked to talk about major changes or trends or needs for research and policies, and I got asked this question by editors as well. I come up with 3 keywords: systemic, regulatory, synergistic. By systemic, I mean intersectoral, coordinated action guided by system thinking. It's important to say that multi-setting, multi-component intervention are not necessarily systemic intervention, but systemic intervention requires joint action from different sectors and peoples. Regulatory interventions, individual-focused intervention are not sustainable, difficult to scale up, and may not be effective at population level. So we have seen that more countries taking approach what we call a hard approach through regulations, through tax, to really make the environment healthier for people, rather than to persuade individuals to make change. Synergistic. Many challenges facing our world now share common drivers and solutions. They coexist in time and places. So at the moment, we are co-writing the WAFL's position paper for physical activity. We talk about how healthy living, obesity, activities lead to climate change, for example. So targeting the common driver, system driver, can lead to win-win, win-win-win, win-win, win-win-win. But there are challenges to make real changes. There are many challenges, but I just list 3 here. Lack of understanding, particularly from the people holding the power to change. Okay, so not recognizing obesity as an NCD, and what that system approach really mean in practice. How synergy work differently in different countries. Something work in the UK may not work for Thailand, China, Malaysia. We need also hear the voice from people with lived experience. They need to be on the table. Lack of political commitment. Evidence and guidelines are this much. We don't need any more cool evidence guidelines. We need actions. Action from people with power to change, the political commitment. We also need more data, reliable data that can be linked across sectors. Lack of data, quality data is a problem, and we need empirical evidence really to prove to the leaders, to others that this will work. Okay, 2 minutes, that's more than I thought. Oh, okay, so try to think more positive. There are things we can still do, and here are some invitations for your contributions. Co-creating with policymakers is the key to gain and sustain political commitment for real changes and to close the gap between research and evidence-based policy changes. At WOLF, we represent our 110 national bodies in over 125 countries. And we are working with WHO and United Nations and other agencies to really try to shape and guide policymaking around the world. We always welcome submission of new evidence. So if any of you have some amazing evidence you want to share, we're really happy to hear, to include in our guidelines and position papers, and also our policy dossiers. So at the moment, I'm editing a special issue, particularly welcome paper focused on systemic, synergistic, and regulatory research initiatives. So you're more than welcome to grab me and talk to me, send me an email if you want to talk about it. And finally, next month, on the 21st of October, I will be chairing a global event in the Bristol City Hall. President from 4 leading international scientific organizations in system science and senior leader from WHO and Lancer and WOLF will be sitting together. We want to advance the understanding, the use, and also the development of system science in health research and in policy making. We are developing the world's first guidelines for writing and reporting system science in health. So if you're interested, you're more than welcome to join us.